Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, worries over proposed resident doctor strike as country battles coronavirus. National Coordinator of Presidential Task Force on COVID-19 clarifies funds and operations account. And the UK government to drop plans for all English primary pupils to return to school before the end of summer. We begin with the figures from the Nigeria Center for Disease Control. Lagos State is still the state with the highest number of COVID-19 infections, with 128 infections of the 315 new cases announced by the NCTC last night, while 4,040 patients have so far recovered from the virus. 361 deaths out of the total 12,801 cases have been recorded throughout the country. Of the 315 new cases recorded in 13 states and the Federal Capital Territory, apart from Lagos, which had 128 of the cases, 34 were confirmed in the FCT, Rivers 32, Edo 28, Oyo 22, Kaduna 20, Gombe 13, Ogun 8, Plateau 5, Delta and Kwara 7 each, Kano 5, Bauchi 4, and Katsina 2 cases. A breakdown of the region shows Lagos topping the country and also topping the southwest with the highest positive cases at 5,895, followed by Kano in the northwest, now with 1,004 cases. The FCT is the third highest with 986 cases. Edo leads in the south-south with 429 cases. Borno retains its 356 cases but comes top in the northeast, while Ebonyi still leads in the southeast, but with cases unchanged at 103. Now, the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Liu, has been clarifying the use of funds released for the operation of the task force on COVID-19. He was on our breakfast program, Sunrise Daily, today and says that all protocols are observed when it comes to release of funds and spendings by the PTF. He insists the Presidential Task Force is prudent in spending its funds.
The role of the PTF, we have a multi-sectoral responsibility, okay? So we have a host of ministries and departments that are part of the PTF, and people are given responsibility in terms of their own budget line. They then make a report to us, and they provide us with all the evidence in terms of whether they have procured or they have spent money. And that level of evidence needs to be the same level of evidence they would need to pay. And we will then make a recommendation to the Accountant General to pay the money. At the moment, as far as I know, only 169 million or so was spent by the Ministry of Foreign Affairs on the evacuation of Nigerians, mainly on their accommodation. So we've got about 22 billion that was released to the PTF. And just to make it clear, the PTF is not a procuring body at all. At the moment, that's less than 0.002%. And the reason why we haven't spent so much is because of the need for prudency in the first place. We need to have clear evidence. A lot of the MDAs are yet to do their full procurement. A lot of the MDAs are still using some of their 2020 budget for their normal activities. And as far as I'm concerned, there's no problem here.
The lady you see is a survivor of COVID-19 and is being discharged after undergoing treatment at an isolation center in Delta State. She was admitted into the treatment center after she felt feverish, lost the sense of smell and taste, some of the symptoms of the coronavirus. But after testing negative twice, she is now going home to reunite with her loved ones.
You have passed 10 days after symptom onset. You have had at least 3 days without symptoms. Your oxygen saturation has been more than 95% in room air for more than 30 days. You have exceeded 14 days after the initial positive result, and your PCRO is now negative, be assured of our warmest regards. Once again, congratulations.
I started feeling feverish. I had constant headache for some days, so I thought it was regular malaria. Then I took malaria drugs, but it didn't stop. I kept feeling feverish, and then I noticed I was having sore throat. After a while, I lost my sense of smell and taste completely. That was when I knew that there was a problem, and then I got tested. This virus is very real. It is not a scam like most people think. It is very, very real. And I would also want them to listen to what the government says. They should wash their hands regularly, maintain social distancing, use their hand sanitizers, because the virus is very real. It's not a scam.
In the meantime, the state government has advised citizens to desist from flouting the directive to maintain social distancing and other safety protocols.
If our people don't heed to these different protocols that we kept talking about, we run as a country run the risk of having to become overwhelmed like it is in the advanced world. We pray that doesn't happen, and that's why we're insisting that our people continue to observe all the health protocols that are very well established, so that at the end of the day, we are all able to curb the spread.
The United Nations Population Fund has donated first sets of personal protective equipment to Yobe State government for the management of COVID-19 patients, as well as survivors of sexual assault, making the symbolic presentation in Damaturu. The program officer says the PPEs are useful for managing COVID-19 patients. The items include 1,750 face masks, 2,800 hand gloves, 193 sanitizers, amongst others.
We are supporting the state with personal protective equipment for essential service delivery points for sexual and reproductive health and gender-based violence. So behind me today are the first set of personal protective equipment that we are donating to Yobe State government. We are donating face masks, hand sanitizers, elbow-length gloves for gynecological procedures and obstetric procedures. We are also donating short sterile gloves, and subsequently we are also going to be donating flash thermometers and self-operated hand wash to be stationed at designated service delivery points for sexual and reproductive health and gender-based violence.
The Nigerian Association of Resident Doctors, NARD, says it is unhappy with the poor preparedness and persistent lack of access to PPEs for healthcare workers leading the front lines in Nigerian hospitals following the risks to coronavirus. Members at a virtual meeting of the scientific conference also lamented on the non-implementation of the revised hazard allowance, non-procurement of life insurance, non-payment of COVID-19 inducement allowance to doctors in various health institutions, among others. NARD is calling on the federal and state governments to improve the welfare of members in the state's tertiary institutions and condemns the unjust and callous cuts in salaries by members of some state governments, saying that it will embark on a total and indefinite strike if after the 14 days ultimatum the government doesn't address the issues. All over the world, we're seeing reports of health workers who are overworked, under-equipped, scared. Some are afraid to go home because they might infect their families. Some are even walking off the job because they don't have the PPEs they need to work safely. Never has there been a more appropriate time to focus on health workers, and rarely have they faced such danger on a massive scale as we're seeing it with the virus. But what are the Nigerian government's obligations to keeping frontline health workers across the country safe? We have Dr. Safia Ojo, a consultant family physician and clinical director of Trust Charities Hospital in Abuja. She joins us on the program from Abuja studios. Glad to have you on the program. Thank you for joining us. Let's begin by asking...
Thanks for having me.
...what your thoughts are with regards to what are the things frontline workers need to battle COVID-19, and are we getting it?
Thank you very much. COVID-19 is a battle. We know it's a pandemic. which has affected a lot of countries. It has resulted in a large death toll in some parts of the world. So having personal protective equipment is mandatory for all health workers if we want to win the battle against COVID-19. You can't be a health worker, you don't have face masks, you don't have protective gadgets to use when you come in contact with patients. So because they also have to protect their lives. So all these things has to be put into consideration. They need to protect the right equipment in all hospitals. They need to ensure that all these health workers are properly protected so that they can also see patients. You won't have the cases of doctors trying to run out of some hospitals when they have cases of patients suspected of having COVID. So I think the best thing to do is the government should ensure all the personal protective equipment, that's the PPEs, should be made available to every hospital, clinic, even the isolation centers. These things are not money intensive. They are things we can actually produce in the country if we want to, or make sure it's readily available to all health workers. So by so doing, I think the health workers will be encouraged to try and do their best to make sure patients are being seen and treated for COVID-19. So I think a lot has to be done when we're talking about trying to provide the gadgets needed. It's something that can be provided. It's not something that is what they need to work with. So I think government should try and ensure that and make sure all hospitals are well equipped, all the necessary equipment for health workers, doctors, nurses, and other health workers to work with is made available. And that brings us to the point of, okay, trying to talk about the warning strike now. Because you can't have a pandemic that is overwhelming, and at the end of the day, you're not even paying them what they need to be paid. All the promises you made, this is even the best time to ensure that all payments are allowances, hazard allowances, and every other payment is being made. That will even make them to enjoy the work more and try to do their best for patients. These are people, the doctors, the nurses are from families. They need to be protected against COVID-19 too. So I think talking about combating and the war against COVID-19, all these things has to be made very available. It shouldn't be an issue. Talking about PPEs should be made available. A lot of funds have been donated for this COVID-19. You just need a fraction, a small fraction of it. Although a meeting was held yesterday with health workers, some of the ministers involved, that talked about the fact that all those things that the health workers asked for will be provided. So I think that should be made available within these 2 weeks.
All right. The question a lot of people are asking, Dr. Joe, the question a lot of people indeed are asking is that they hope that the federal government and state governments are listening and also elevating the voices of frontline workers with regards to exactly what they need so that they can provide it. But I must quickly ask you about the new novel coronavirus and how it has affected family health. And seeing as you're a consultant in that field, how do you distinguish between common cold and bronchitis and, COVID-19?
Okay, thank you very much. Talking about COVID-19 and its symptoms. Yes, COVID-19 could actually, is a novel virus, which means it's a new virus. There's new strain of coronavirus. Coronavirus is not a new virus per se, but this strain we are having is a new strain of coronavirus. Usually, virus infections go unnoticed sometimes. You could even be asymptomatic, or maybe come with mild symptoms of catarrh, cough, cold, and at the end of the day, it's gone. But we know COVID-19 can cause both mild, moderate to severe illnesses, even requiring ICU care. So I think COVID-19, yes, the symptoms are cough, difficulty in breathing, chest tightness. You have some other symptoms like GIT symptoms like diarrhea and other GIT vomiting. But there is a way we can differentiate this. COVID-19 symptoms similar to malaria. Some of the symptoms are also similar to pneumonia, the normal bacterial pneumonia that's been there for years. We have viral pneumonia, we have other types of pneumonia. But now that we should have high index of suspicion because the symptoms are similar. If you're treating malaria is not going, you should have a high index of suspicion. Okay. Then when you have any of these symptoms, rare symptoms like anosmia, you can't even smell something, you're having some symptoms that you're not having again before, constant headaches and all that, you should seek for care. Ideally, a lot of people should be tested, even without symptoms. But now, because we don't have provision for that, a lot of people should be tested. I say people that go to hospital for one reason or the other should actually be tested for COVID if the resources are made available. So the major symptom we're talking about, even the fever may not be present in some people. We know that it should be fever. You may not have all the symptoms. It may even go unnoticed in some people. Some people may even be asymptomatic, not even having any symptom.
I wish we had a lot of time, but we'd like to thank you. Lots of points there made, especially mentioning the high index of suspicions. But we would like to thank you. Hopefully we'll have you again. Dr. Sefriel Jo, consultant, family physician, clinical director of Trust Charities Hospital. Thank you for joining us on the program.
Thank you for having me here.
Still to come, where are we with traditional and alternative medicine to COVID-19? That's up next. Welcome back. There are risks associated with the increased use of antibiotics for the treatment of COVID-19 in the country. This is a concern for the World Health Organization. According to the WHO representative in Nigeria, the practice has led to a rise in resistance to antibiotic drugs used in the treatment of other diseases. Ms. Fiona Bracker made the observation at the Presidential Task Force on COVID-19 briefing in Abuja yesterday.
The COVID pandemic has led to increased use of antibiotics, which ultimately lead to higher bacterial resistance rates that will ultimately impact the burden of disease and deaths during the pandemic and beyond. New antimicrobial resistance data released by WHO shows that globally a worrying number of bacterial infections are increasingly resistant to the medicines at hand to treat them. We also know that based on evidence, only a small proportion of COVID-19 patients do need antibiotics to treat subsequent bacterial infections. And the organization has released new clinical management guidance not to provide antibiotic therapy or prophylaxis to patients with mild COVID-19 or to patients with suspected or confirmed moderate COVID-19 illness, unless there is a clinical indication to do so. The choice of antibiotics is based on the clinical diagnosis, the local epidemiology, and antibiotic susceptibility, as well as the treatment guidelines. So close review and monitoring of patients is therefore required to determine when to use the antibiotics. Thank you.
Well, that's WHO on antibiotics. But you've heard of the COVID organics from Madagascar. Well, that is one alternative, traditional complementary and alternative medicine to COVID-19. But what is Nigeria doing? We find out as the pharmacist, Joseph Gia, an assistant director, head division, complementary and alternative medicine, Department of Traditional Complementary and Alternative Medicine, Federal Minister of Health, Abuja, joins us on the program. Glad to have you join us. Thank you. First, we'd like to know, indeed, what, or rather, how involved is the traditional complementary and alternative medicine practitioners in finding a solution to COVID-19?
All right. Thank you so much. I think the first thing is actually to know what traditional medicines are, because there's a lot of confusion in the minds of people as to what traditional medicine, complementary alternative medicines are. Traditional medicine has been with us since ages, and these are the medicine practices that our forefathers used that has kept them, kept us also alive up to today. And these are practices that have been handed over from ages to ages, like WHO said, whether they are explainable or could not be explained, but they have been seen to work. And then the complementary alternative medicines are medicines practices that are outside of the conventional medical practice for now. So the traditional medicine department of the Federal Ministry of Health has continued to receive a lot of questions, just like we ask now. And the first fact we need to do is that in Nigeria, we have over 8,000 species of medicinal plants that are there and are waiting for use by researchers, by people on the field. We have a lot of a different group of people actually working on these plants. We have the researchers, we have the practitioners who actually are not into laboratory analysis, but they have been using these plants for years. And so at the beginning of the pandemic, when there was confusion, there was this helplessness, the traditional medicine came up. We remember nations who have come up with remedies from plants that could be used in managing COVID-19.
So, Mr.
Some are
Gia,
to manage the symptoms.
I must quickly ask you,
yes,
Mr. Gia, how close is Nigeria to finding something that it can use as treatment or as a vaccine for COVID-19?
All right, thank you. Nigeria is moving very fast, I would say, because quite a lot of people have done some works who have actually got in touch with the ministry. About 3 weeks ago, there was this teleconference with those who have claims, and they were listened to. And like you and I know, the first thing for a drug to be approved for use in Nigeria is that it should be subject to scientific evaluation, and this is done by NAFDAC. And as at now, that process is on to get these practitioners, these researchers who have products, quite a lot of them. The products are there, the claims are there, let me call them claims, of people who have a lot of claims. We have quite a lot of them, and they are just being forwarded to NAFDAC to evaluate them and to see if they are actually fit for human consumption and if they are fit to do what they actually supposed to do. As at now, that is the level at which the ministry is, and it is ongoing. More and more claims are coming up. People are bringing in more claims, writing to the ministry. We have this, we have that, and the ministry is looking at those claims and forwarding them to the relevant agencies that will look at these claims, evaluate them, and come up with a remedy. I want to believe very shortly remedies, not just remedies will come up from these claims that could be used in tackling this menace that seems to, not to answer to the conventional method or the conventional medical practice for now. Why they do the research in the laboratories, these ones are available. And I want to believe very shortly, like I said, they will be made available, but that definitely will be after evaluation by NAFDAC.
And validation. We appreciate your time, Mr. Joseph Nathaniel Gia, Assistant Director, Head of Division, Complementary and Alternative Medicine at the Federal Ministry of Health. Thank you for joining us on the program.
Thank you for having me.
The plan to get all primary school years in England back to school before the end of term is set to be dropped by the government. The ambition was for all primary school children to return before the summer holidays, according to the Department of Education. However, this is no longer thought to be feasible, and Education Secretary Gavin Williamson is due to deliver a statement to Parliament on wider reopening of schools. Anne Longfield, the Children's Commissioner for England, said it's a huge disappointment for children who had expected to go back into school before the summer and now may not. And from the NCTC, while they work to provide Nigerians with verified information on infectious diseases, the NCTC team continues to monitor misinformation on COVID-19. The centre says you can help out by submitting rumours on its new reporting platform. Their website has all the information, statistics on COVID-19 cases across states with regular updates on the COVID-19 regulations and guidelines. And from the World Health Organization, you find the coronavirus disease situation dashboard and also the global numbers and numbers of country of COVID-19 cases on a daily basis. The website has rolling updates on the pandemic, and each moment it keeps updating. Our website, channelstv.com, has the latest news. All you need to do is log on, access news and health, politics, sports, Africa, and around the world. It's channelstv.com. That's the COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Bye for now.